guys, welcome to MedCouragement. I'm Dr. Aaron McGuffin, board certified pediatrician, and here to talk to you today about a very important topic, teething. And it's one of those things that's come into vogue recently because of some of the issues surrounding those amber teething bracelets. We've seen some warnings come out from the American Academy of Pediatrics as well as from the FDA, where we've had some deaths associated with strangulation, and there have been incidences of choking as well. So we're going to talk a little bit about teething and the do's and the don'ts of teething today. First of all, we know that teething is typically hits around 4 to 7 months, and a lot of times you'll see your child begin to put the hands in the mouth. You see the drooling, they become a little bit irritable. Occasionally you'll see them get a little bit of a higher temp. Again, a fever for us is about 100.4 or above. Some people will argue that you don't get a fever with teething. All 4 of my children did, and a lot of my patients do as well. So there's what the science says, and then there's what we all see practically happen. But those are some signs, and typically they get those front 2 bottom teeth and the upper teeth in there initially, and they can obviously have a lot of struggles with that. So what do you do and what don't you do? So some of the things that you can do for this, for one, obviously, is simple things. One, of course, you go to the cold toys that the baby can chew on, and I'll provide some links to some items below that I recommend. The rule is to make sure you don't give them something that's frozen. That may be too hard, and we obviously don't want something that's completely rock solid. But something that's nice and cool. I'll have some parents actually use wash rags that are nice and cool. And there are some toys out there. You have to be careful. Some of them actually have water retained in them, or water can sneak in there, and you need to be careful with those. It's very similar to some of the bath toys because those can be breeding grounds for mold and bacteria and so forth. So you have to be careful with exactly which product you buy. You can also do massage. Very simple. Make sure you wash your hands well. And you can use your finger or knuckle just to sort of massage the gums, which can also provide some great relief to infants. We know that touch is obviously a very powerful way to calm them, and certainly massage technique with the gums is appropriate. And TYLENOL. TYLENOL is certainly something that you can try. Make sure, based on your child's weight, that you have an appropriate dose, and you can check with your pediatrician or other healthcare provider to make sure that you are given the correct dose of TYLENOL for the patient. Again, we do not recommend Motrin for children under 6 months of age. After 6 months of age, Motrin is fine, but again, you need to make sure you have the appropriate dose. So what don't you do? Some of the things we don't recommend, one, of course, are the teething necklaces. We've had the instance where an 18-month-old actually died from strangulation, and we've had instances where the children actually pulled the beads off, and some of these are wood beads, and some of these are actually amber, and they can swallow them. And so that's a choking hazard. That's a visit to the ER to make sure that something isn't lodged somewhere in the throat or in the airway. Secondly, we get lots of questions about Orajel. Any product that has benzocaine in it, which is a numbing agent, is not something that we recommend. There is concern about numbing the throat and some toxicity with that. So in general, we recommend to stay away from benzocaine. And again, I'll provide some links for some things that I think are perfectly safe for the child and can help with some of these teething issues. So I hope you learned some things today about what to do, what not to do. For sure, cold toys that are good, considered chew toys. Again, I'll provide some links below for those. Secondly, you can do massage, and 3, TYLENOL. The don'ts: make sure you don't have anything around the baby's neck at any time. For risks of strangulation, risks of choking should the necklace break, and then avoid the benzocaine products. Okay. Well, I hope you have learned some things today. I hope you've had a great day. If you have any other tricks of the trade, we'd love to hear them in our comments below. And we thank you for watching the MedCouragement videos. And we're excited to make more. If you have some ideas for some things you'd like to provide some more information from, we'd be happy to help create those videos for you. And be sure to subscribe to our channel, and that way you can get all the updates on when we have new topics that are coming forward. Thanks so much, and I hope you have a fantastic day.